There is something most people never realize about the human body. The body was designed to move, not occasionally, not once a week, not only during workouts, every single day. And when movement slowly disappears from life, the body notices. But the dangerous part is this: the damage usually begins quietly, not dramatically, not all at once. Most people do not wake up one morning suddenly feeling unhealthy. Instead, the changes happen slowly. A little more fatigue, a little more stiffness, a little less balance, a little more shortness of breath, a little more brain fog, and because the changes happen gradually, people adapt to them. They assume it is simply aging, stress, busy schedules, getting older. But in many cases, the body is reacting to something much simpler: a lack of daily movement. My name is Dr. Kenji Sato. Welcome to Health Lab. Today, we are going to talk about what actually happens to your body when you stop walking every day. Because walking is not just exercise. Walking affects circulation, the brain, the heart, the muscles, the joints, energy levels, balance, sleep, even long-term disease risk. And what surprises many people is how quickly the body begins changing when movement disappears. So stay with me until the end, because later in this video, I will explain why even short daily walks can have surprisingly powerful effects on brain and cardiovascular health. Now let me tell you about someone I once met. His name was Richard. Richard was 71 years old. For most of his life, he stayed active without really thinking about it. He walked to nearby stores, worked in his garden, moved around the house constantly, walked every evening after dinner with his wife. Nothing extreme, just movement. Then retirement changed his routine. He began spending more time sitting, more television, more time indoors, less walking, less movement. At first, nothing seemed different. But after several months, Richard noticed something strange. He felt tired more often. His legs felt weaker. He became short of breath climbing stairs. His balance felt less stable. He slept worse. And mentally, he felt slower. Eventually, he told me something I hear very often. "Doctor, I feel like my body aged 10 years in 1 year." And honestly, his body had changed. Not because aging suddenly accelerated overnight, but because movement disappeared. And this is exactly why today's conversation matters. Because walking is one of the most underestimated forms of medicine the human body has. So let's begin with something important. What actually happens inside the body when daily walking stops? The first thing affected is circulation. Your circulatory system depends heavily on movement. Every time you walk, the muscles in your legs help push blood back toward the heart. This improves circulation throughout the body. It helps regulate blood pressure. It supports oxygen delivery. But when movement decreases, blood flow becomes less efficient. People often begin noticing cold feet, swollen ankles, leg stiffness, fatigue, or a heavy sensation in the legs. Sitting for long periods also allows blood to pool more easily in the lower body, and over time, poor circulation increases stress on the cardiovascular system. Now, I want to clarify something. You do not need to become an athlete. The body simply needs regular movement. That is what many people misunderstand. Walking is not valuable because it is intense. Walking is valuable because it is consistent. The second thing affected is the heart. Your heart is a muscle, and like all muscles, it responds to how you use it. Regular walking helps the heart pump more efficiently. It supports healthy blood pressure. It improves circulation, and it helps maintain cardiovascular endurance. But when movement disappears, the heart gradually becomes less conditioned. Simple activities begin feeling harder. People become winded carrying groceries. Climbing stairs feels exhausting. Daily tasks require more effort. And unfortunately, inactivity is strongly linked to increased risk of heart disease, stroke, high blood pressure, and metabolic dysfunction. This is one reason doctors constantly encourage daily movement, not because walking is trendy, but because the cardiovascular system depends on it. Now let's talk about something many people do not expect: the brain. Walking has enormous effects on brain health. In fact, movement directly affects blood flow to the brain, and the brain depends entirely on oxygen-rich circulation. When you walk regularly, blood flow improves, oxygen delivery improves, the brain receives stimulation, stress hormones decrease. Research has repeatedly shown links between regular walking and improved memory, focus, mood, and cognitive health. But inactivity creates the opposite effect. Many people who stop moving regularly begin experiencing mental fog, poor concentration, low motivation, memory lapses, fatigue, mood changes. Some even describe it as feeling mentally stuck. And honestly, there's biological truth behind that feeling. The human brain functions better when the body moves. Now there is something especially important older adults should understand. Walking also affects balance. Balance is not automatic. It is a system the body continuously trains. Walking helps maintain coordination, muscle control, joint stability, spatial awareness, reaction speed. But when movement decreases, balance slowly weakens. This is why people who become sedentary often feel less stable over time. And unfortunately, poor balance dramatically increases fall risk. Falls are one of the biggest causes of injury among older adults. And sometimes, the decline begins with something surprisingly simple: a loss of daily walking. Now let's talk about the muscles. Muscles are metabolically active tissue. They are designed to be used. When muscles stop being challenged regularly, the body begins breaking them down. This process can happen much faster than people expect, especially after middle age. Leg muscles weaken, core stability decreases, joint support worsens, posture changes, physical stamina declines, and once strength decreases, people often move even less, which creates a dangerous cycle. Less movement leads to weakness. Weakness leads to even less movement. And over time, simple tasks become more difficult. Getting out of chairs, walking longer distances, carrying groceries, standing for long periods. This is one reason walking matters so much. It helps maintain functional independence. Now I want to mention something else many people ignore: joint stiffness. People often assume joints should naturally become stiff with age, but inactivity plays a major role. Movement helps lubricate joints. It supports flexibility. It maintains mobility. When people sit for long periods every day, stiffness often increases. The hips tighten. The lower back stiffens. The knees ache. The ankles lose mobility. And eventually, movement itself starts feeling uncomfortable. Then people avoid movement even more. Again, the cycle becomes self-reinforcing. Now let's talk about blood sugar. This is extremely important. Walking helps the body regulate glucose more effectively. After meals, muscles use glucose for energy. Movement helps remove sugar from the bloodstream. This supports healthier metabolic function. But prolonged inactivity can worsen insulin resistance, and over time, that increases risk for prediabetes, type 2 diabetes, weight gain, inflammation, cardiovascular disease. This is why even short walks after meals can be surprisingly beneficial. Sometimes, a simple 10-minute walk after eating can support blood sugar control significantly. Now I want to talk briefly about inflammation, because many chronic diseases are connected to chronic inflammation. The body responds poorly to long-term inactivity. Sedentary behavior is associated with higher levels of inflammation in the body, and inflammation affects the arteries, the heart, the brain, the joints, the immune system. Movement helps regulate many of these systems. Again, not because walking is magical, but because the body was designed for regular motion. Now there is another area many people overlook: sleep. People who stop moving regularly often sleep worse. They struggle to fall asleep, wake up more frequently, feel less rested in the morning, experience lower energy throughout the day. Regular walking helps regulate sleep rhythms. It reduces stress. It supports nervous system regulation. And it improves overall sleep quality for many people. And sleep matters far more than most people realize. Poor sleep affects blood pressure, memory, mood, immune function, hormones, appetite, cardiovascular health. Everything inside the body is connected. Now I want to pause for a moment, because some people watching this video may feel discouraged. Maybe your mobility is limited. Maybe you have chronic pain. Maybe you stopped walking regularly years ago. Please understand, this conversation is not about guilt. It is about awareness. The body is incredibly adaptable. Even small amounts of movement can create meaningful improvements over time. You do not need perfection. You need consistency. And honestly, this is where many people fail. They believe health only improves through extreme exercise, intense workouts, complicated programs, painful routines. But some of the greatest health benefits come from simple behaviors repeated consistently. Walking is one of those behaviors. Now let's talk about mood and emotional health, because walking affects far more than the body. It also affects the nervous system. Many people notice their stress decreases after walking. Their thoughts feel clearer. Their anxiety becomes calmer. Their mood improves. This is not imaginary. Movement changes brain chemistry. Walking can help regulate stress hormones, increase circulation, support neurotransmitter balance, and improve emotional regulation. This is one reason people often say, "I feel better after a walk." The body and brain are deeply connected. Now there is another dangerous effect of prolonged sitting I want people to understand: loss of endurance. When people stop walking regularly, the body becomes less efficient at physical effort. This means ordinary activities begin requiring more energy. And once daily tasks feel exhausting, people often become even more sedentary. This creates another dangerous cycle. Fatigue leads to inactivity. Inactivity leads to worse endurance. Worse endurance leads to more fatigue. Over time, people can become trapped inside that cycle without realizing how it began. Now let me explain something extremely important. Walking is not only about adding years to life, it is also about adding quality to life: independence, mobility, confidence, energy, mental clarity. These things matter. Many people focus only on lifespan, but health span matters too. The ability to move comfortably, think clearly, remain independent, enjoy daily life. Walking supports all of those things. Now I want to discuss something called sedentary adaptation. This happens when the body slowly becomes accustomed to inactivity. People move less, so their stamina decreases. Then activity feels harder, so they avoid movement. Eventually, low energy begins feeling normal. People say, I guess this is just aging. But often, inactivity is playing a much larger role than they realize. Now let's talk briefly about longevity. Some of the healthiest populations in the world share something interesting in common. They move naturally throughout the day, not necessarily intense workouts, walking, gardening, daily chores, climbing stairs, regular physical movement. The human body thrives on regular activity. And honestly, modern life makes inactivity incredibly easy. Cars, computers, television, phones, hours spent sitting. Many people now spend most of the day physically inactive without fully realizing it, and the body responds accordingly. Now here's the good news. The body also responds positively when movement returns. People who begin walking regularly often notice improvements surprisingly quickly. Better energy, improved mood, less stiffness, better sleep, improved endurance, mental clarity, better circulation, not overnight, but gradually. And those small improvements accumulate over time. Now I want to explain something extremely important. You do not need to walk for hours. Consistency matters more than intensity. Even 20 to 30 minutes per day can support cardiovascular health, brain health, circulation, metabolic health, balance, mood, mobility. And if 30 minutes feels overwhelming, start smaller. 5 minutes matters. 10 minutes matters. Progress matters. Now, before we finish today, I want you to think about something. How much movement disappeared from modern life? People used to walk far more naturally, to work, to stores, to neighbors. Throughout daily tasks, now many people sit for most of the day. And unfortunately, the human body still has the same biological needs it always had. Movement is not optional for long-term health. It is foundational. Now I want to leave you with one final thought. Walking may seem simple. Too simple. That is why many people underestimate it. But simple behaviors practiced consistently are often the most powerful. A daily walk may help support your heart, your brain, your circulation, your joints, your muscles, your mood, your sleep, your independence. And over time, those effects become enormous. So if you have stopped moving regularly, do not panic. Do not focus on perfection. Simply begin again. One walk, one habit, one step at a time. Because the body responds to what you repeatedly do. And very often, small daily choices shape long-term health far more than dramatic short-term efforts. My name is Dr. Kenji Sato. This is Health Lab. Take care of your body. Keep moving. And I will see you in the next video.